Good day everyone, my name is Rian Lucidula Cruz, PSN1A, and today I am going to perform a return demonstration about the cardiovascular and the peripheral vascular system. So we have here already the equipment needed, but first we need to sanitize our hands using alcohol and provide our client privacy. Okay. Hi ma'am, again I am Rian, your student nurse for today. I am here to do an assessment wherein I am going to inspect, palpate, as well as auscultate you. Therefore, I'm going to touch some parts of your body. Is it okay with you ma'am?
Yes.
May I know your name please?
My name is Shalama Itabuga.
Okay, ma'am Shala. First thing that I will be doing is to get your health history. Shall we start?
Yes, ma'am.
Okay. Do you experience any pain? And if so, does it radiate to some other areas?
No.
No. Okay. If you feel pain, how often did the pain last?
Not that too long.
Okay. Okay. Can you rate it in the scale of 10, in which 10 is the worst and 1 is the opposite of it?
3 to 4.
Okay. Okay, what brings the pain?
When I do some work.
Okay. Okay. What relieves the pain then?
When I take a rest.
Yes. Okay. Do you have any other symptoms with this pain, like shortness of breath, perspiration or diaphoresis, pale, clammy skin, nausea, vomiting, heartbeat skips or speed up?
No.
None. Okay. Does your heartbeat faster? No. Okay. Have you been diagnosed with heart defect or a murmur? Okay. Is there any history of hypertension, myocardial infarction, coronary heart disease, elevated cholesterol level, or diabetes mellitus in your family?
No.
Okay. How about you, ma'am? Do you smoke? Okay. That's great. Because cigarette smoking greatly increases the risk of heart disease. Do you exercise when you do, how often it is?
Every morning.
Okay. Every day. Okay. That's it for the health history taking. Now I am going to assess and inspect if the patient has any skin discoloration or cyanosis, pallor, masses, or any abnormal findings. And as what I have observed earlier, I haven't seen any symptoms of that. Let me proceed with the palpation of the patient. Could you please lay down in a supine position, ma'am? Okay. Okay. Could you please look at the left side? Okay. So just look straight, ma'am. Could you please sit now? Okay, so could you please lay down again now? I just remain lay down. Okay. Ready, pause.
Just stand here. Normal. The other one.
Okay, you can sit now, ma'am. Okay, so that's it. So the findings are in the neck. Um, the jugular vein is not distended, bulging, or protruding at 45 degrees. Therefore, it is normal. No swishing and blowing of any other sound heard, and the pulses are equally strong for about 2 plus, which is normal. And the arteries are elastic and no trills are noted. When palpating, the apical impulse amplitude is usually small, like a gentle tap. So the duration is brief, lasting through the first two-thirds of systole and often less. So there is no murmur or any extra sound heard, and the S1 and S2 are normally present. So the skin is warm to touch bilaterally from fingertips to upper arm, and the skin color is appropriate for her ethnicity, and I don't see any pallor, cyanosis, or any abnormalities. So pink coloration returns to the palms within 3 to 5 seconds in both ulnar artery and the radial artery. And the capillary bed returns to its normal color in 2 seconds or less. Also, the radial pulses are bilaterally strong for about 2 plus, and the artery walls have a resilient quality or bounce. The ulnar pulses may not be detectable, and the brachial have equal strength bilaterally. Normally, the epithelial lymph nodes are not palpable. So she has no edema, the toes and legs are equally warm bilaterally. For pulses, it is not unusual for the popliteal pulse to be difficult or impossible to detect, and yet for circulation to be normal. So dorsalis, pedis pulses are bilaterally strong, and the posterior tibial pulses is strong bilaterally as well. So that's all. That ends my return demonstration. Thank you for watching.